The key message that I'd like Mumsnet to take away today from the programme is that this is an unacceptable practice in our own country, in the United Kingdom. And although this is an international programme, we have a diaspora and they are intrinsically linked. So I hope Mumsnet and all Mumsnetters will keep an eye out for girls that they think might be at risk and use the opportunity to report to a local authority of some sort, whether it's the police, the local child safeguarding board, teachers. But it's against the law also to take the child out of the country. And if you know a child's going away and you suspect something, report it, don't wait. It's an abhorrent practice and the girls need our help. One of the questions I'm always being asked is about why there are no prosecutions. And there have been no prosecutions or successful prosecutions since it became illegal in 2003. Not for lack of trying, but very, very hard to get children to give evidence against, well, babies to give evidence against their parents. But it's not just the evidential thing. It's about, firstly, awareness on the front line. So teachers and social workers and police, the Home Office prepared guidelines so they can actually spot a girl who's at risk. For example, a girl at risk might take her half an hour to go to the loo. So if a teacher sees that it takes half an hour, that might be a sign that she has been cut and has some very serious medical consequences of it. In terms of the Director of Public Prosecutions has put together an action plan, so frustrated with the lack of prosecutions, and two, that actually there were prosecutions but they fell before the final hurdle. So the action plan is there, and we're looking. I'm going with Jeremy Brown, who's the Minister in the Home Office, in the next 2 weeks to meet with the Met lead on child abuse, who has gone on the record publicly to say that he will relentlessly pursue FGM offenders. So I think there is, and with the momentum behind this campaign, and with DFID leading with the Overseas programme, I think there's a real momentum to try and get that prosecution to send out a message very clearly to say this is against the law, it's unacceptable, and we will prosecute. In terms of supporting this campaign, Mumsnetters could really help just by raising it in their schools if they live in one of the areas where it's prevalent. It's where communities are. There are parts of the country in which it's not practiced. As I said before, if you suspect a child is at risk, then contact somebody in authority and spread the word. We need to galvanise a world movement on this. The DFID campaign is an international programme, but we have the diaspora here. We need every country in the world and every organisation and every individual to support it, to raise awareness, and if they actually see something they're worried about, to report it. I think Mumsnet's campaign on bounty representatives is excellent. And I think, when you've just had a baby, that's probably the last moment at which you want to be force-fed, literally, with products or services. You may be very grateful at another time to know what's on offer, not 10 minutes after you have a baby. So I very much salute Mumsnet's campaign, and I think they will be successful. I think the level of publicity, harmful publicity to these bounty reps who are actually doing it, and to the hospitals who are inviting them onto their wards. So I think purely on reputational grounds, Mumsnet will be successful, but I think they need to really localise the campaign. So if a Mumsnetter lives in an area where a hospital is allowing this to happen on their maternity wards, they should tell them what they think.